Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
We have more evidence tonight of the chronic problems affecting social care services in England. There's been a shocking rise in the number of people waiting to leave hospitals because the support they need at home isn't available. Figures from NHS England show that in July, more than 61,000 extra days were spent in hospital because of delays in providing social care. That's an 80% increase in 2 years. And the cost to the NHS in England is enormous. It's estimated it spends £820 million a year on older patients who don't need to be in hospital. A report by health experts today says it's evidence of a system in crisis. Our social affairs correspondent Alison Holt has spent a day at the Royal Liverpool Hospital and has this special report. Just a warning, it contains flashing images.
It's 9 o'clock in the morning and the Royal Liverpool Hospital is under pressure again. In accident and emergency, patients needing immediate treatment keep on arriving. Many are elderly.
At the minute, the A&E department is full.
Each of these red dots represents someone who has been waiting for more than 4 hours, breaching government targets. One patient has been here 18 hours, ready to be moved to a ward.
There's no capacity. We are actually overflowing in A&E, so there is a problem. Ambulances will be queuing up.
You must be really frustrated with that.
Yes, to be honest with you.
Rather full downstairs with over a ward of patients. We need to get those patients moved as soon as possible.
Upstairs, senior staff are trying to free up beds for the new patients needing operations or emergency treatment.
There's no trolley space in resus, and we have 2 patients waiting in the corridor at the moment.
Have we got any patients identified that can move?
Yeah, there's about 3 or 4 in there that could move out, but we've got no elderly in the department to move them out to. So.
They have more than 100 patients who are ready to leave hospital, but can't because of delays in getting home care, residential care or community nursing.
This is happening almost every day. Surgery can't start this morning until we've identified a bed for somebody to then return to after theatre.
Good afternoon, how are you?
Oh, not so bad, right?
86-year-old Derek Chin is one of the patients who will go home during the day. He's been on the specialist stroke ward whilst waiting for extra home care to be organised. This was the only bed available to doctors, even though he had a fall, not a stroke.
Essentially, it's a very expensive residential home bed. He isn't the problem, it's our system, preventing us from discharging people appropriately, which means that the acute patients who really do have a need for these beds are being delayed downstairs in the accident and emergency department.
On another ward, Camille Fennell has been waiting 72 days to leave the hospital, but the council is struggling to find a care provider that can support her at home 4 times a day.
They should do more to get people back into the community.
And you're still waiting?
I'm still waiting, yeah. I'm a very independent person.
So you don't really want to be here, do you?
No, not really, no.
An increasing number of hospitals in England face these pressures.
More and more cuts are expected from us.
In Liverpool, the man who runs the council's social care says they are struggling with budget cuts and staff shortages.
We are seeing more people with high demands in terms of their health and their well-being. People are living longer, which is great, we celebrate it, but we don't have the services out there to cope with that number.
This sounds like a system at breaking point.
It is, and that's what keeps me awake at night.
The government says it's making significantly more money available to social care to ensure affordable, dignified support. It's 5 o'clock and back in A&E at the Royal, there is no let-up in patients needing help. At this point, they don't want us filming inside. For a short period of time, they had to divert ambulances to neighbouring hospitals. They've got 9 people on trolleys in the corridors, and there are no resuscitation beds available at the moment. Upstairs at the latest operations meeting, the implications of that are clear. The emergency department is now on the highest level of alert.
A&E?
We're on the verge of being unsafe.
It means as they head into the evening, they will begin the search for people who can be sent home safely all over again. Alison Holt, BBC News, Liverpool.
More evidence there of the enormous problems facing social service care in England.
Cuts to social care funding are leaving the poor and the elderly at the mercy of a postcode lottery. That's the warning from two leading health charities. They say the cuts, combined with shortages of nurses and care workers, leave the poorest relying on an increasingly threadbare local authority safety net. Our health and social care correspondent, Victoria MacDonald, has been meeting one family that is already struggling with the system.
He was a talker, all right.
Should we go indoors?
He had a great sense of humour. He loves his family, he still loves his family, you could see. And very caring man.
Jackie Brown moved in with her father in 2012 when his dementia worsened. And she says she wants to keep looking after him in his own home for as long as she can and for as long as it's safe. And yet so often the help she hopes for from social services does not appear. A promised stair lift, for instance, or an adapted bathroom.
My main worry is because Dad's mobility going up and down the stairs is not very good and he will fall. I'm worried that he will fall down the stairs and there's nothing I can do to prevent that. They came out and I've done another call to find out what's happened about the stair, the stair lift, and was told that the occupational therapist has left. Therefore, I need to have another referral, which is totally unacceptable.
So she's back to square one. And in a report by the Richmond group of charities today called Real Lives, these stories are being repeated in homes across England.
When you want that little bit of help, you just expect that person at the end of the phone to give a response and at least somebody to give you a call back in a reasonable time frame, really, and to show that somebody out there cares.
This report was launched alongside research by the King's Fund and the Nuffield Trust into social care for older people, and it makes bleak reading. Over the space of 5 years, 250,000 fewer people now receive care. So who gets it? Well, it depends on where they live and how rich they are, the report says.
We were most concerned that there are a huge number of people out there who are reliant on an increasingly threadbare safety net to help support them with what we're talking about is the essentials of everyday life. So helping people get out of bed in the morning, helping them eat, really basic but vital services. And we don't actually know what's happening to the people who now are no longer eligible for local government support.
There is a warning too that care homes are struggling. Councils are paying less for residents, wages are going up, and there's a shortage of nurses. This care home behind me used to be owned by Southern Cross. They owned a number of them across the country. When the company went bust in 2011, it sent a shudder through the industry. Now today's report says that because of the unprecedented pressure on the care home sector, it is a matter of when, not if, that another provider goes out of business. The Department of Health says it is significantly increasing social care funding, but the report's authors say that's not available until 2020 and they need it now. In the meantime, there is a growing number of unpaid carers, the people like Jackie, who do it out of love, of course, but who also need help that does not always come.
If you were watching News at 10 last night, you will have seen our somewhat disturbing report on the way even basic health services are now being rationed. But it's not just the NHS that is feeling the strain. Today, a study of social care in England suggested that the number of people receiving state funding had fallen by a quarter as local authorities cut back spending with the elderly hardest hit. And as you might expect, some cuts are causing really serious distress.
I have to get up at 5:30. Do a medication, do a food. In between that, I've got to do a bit of housework. 10 o'clock, I'd start getting ready for bed, get ready for bed and get myself ready for bed. Just a sandwich.
For thousands of people like Phil Armstrong, being a full-time carer is more than a full-time job. His wife Yvonne has a heart and lung condition requiring oxygen that confines her to the house and demands 24-hour care. But they're at risk of losing the help they currently receive 3 times a day and 2 nights a week, which they say is vital to give Phil a break.
It takes a lot out of you, because you're having to look after somebody that can't do nothing for themselves. It's be all right if everyone could do some of itself, but you can't.
The local NHS, which funds the care, says Yvonne no longer meets its criteria, and Phil is appealing, but their predicament is increasingly common. A report today found that over 5 years, council spending on care for older and disabled people has fallen in real terms by 11% in England, and while the number of people aged over 65 is growing, the number being helped has dropped by a quarter, from more than 1 million to 850,000.
What we don't know is actually what's happening to those people. Are they more reliant now on their families and friends to act as carers? Are they paying for somebody to come in and support them, which, by the way, is very expensive? Or what we know is happening is that a growing number of people are just going without.
Care companies are at risk too. Housing and Care 21, one of the biggest not-for-profit providers, says it's pulling out because it can't provide good quality for the money. And tonight in Birmingham alone, I'm told there are hundreds of patients waiting to be discharged from hospital who can't be because community care isn't in place. It's the same up and down the country, causing problems for the NHS that trickle right the way down to A&E. And now an alliance of leading national charities has come together accusing the government of failing to plan for us all getting older.
Both the NHS and social care are at breaking point now. If you ask anybody working in either side of that partnership, they will tell you that they can't cope.
Phil tells me he's been asked if he has relatives who can step in.
You don't ask your family to help you out because they've got their own life to lead. So I think it's wrong what they're doing.
The government says it is investing in the care system, but it is people like Phil who are now shouldering the burden of our ageing population. Ben Chapman, News at 10, Birmingham.
I've been